Hi, I'm Dr. Ron Rigby of Ogden Clinic. I'd like to welcome you to my clinic. Today we're going to give you a slight introduction of how I approach the weight loss process. Again, my goal is to try to figure out why you're gaining weight and what can we do. Is that something that metabolically going on, hormonally going on, something that we as providers are doing to you in the sense of medication, or there's other things. And this is not a really deep, but a kind of a quick presentation about how I approach this problem. I am a family physician and also certified obesity medicine physician. I look at it from the hormonal aspect. So when we say the word hormones, most of us going, well, it's our sex hormones, our estrogen, our progesterone, our testosterone, and you are correct. But hormones go a lot more in depth than that. They're basically a signal released from one cell that travels through the bloodstream to go tell another cell what to do. And that signaling system is telling adipose or fatty tissues to get bigger. So we want to try to prevent that. It's not as simple as just one hormone, but that's where we're going to start is by looking at it from a hormonal aspect. And again, a brief definition is a chemical messenger that's a signaling system. And one of those key hormones that I want to focus on is insulin. Insulin we always hear about with type 1 and type 2 diabetes. If you're a type 1 diabetic, something happens and your pancreas doesn't produce it. In type 2, we actually produce a lot of it, and then when the cells can't keep up, we might give you insulin. Well, my goal is to have that communication between the insulin and the cell work a little better. So what insulin does helps open up the cells to get the energy, be it carbohydrates, proteins, or fats, into the cell. So now the mitochondria can actually convert it into ATP, which is the fuel source of the body. I know it's very complex and multiple things to go in, and we can go deeper as we talk over time, but that's what we're trying to do is get your body to use or produce more energy more efficiently and get this whole process to work better. Again, I focus on insulin first, but insulin's not the only hormone. We've got thyroid, which is multiple different hormones. We have testosterone. We got estradiol, which is the most active form of the estrogen component. We have progesterone. We have cortisol. We have many others. But we also have environmental factors, be it diet, emotional issues, sleep, activity, habits, behaviors, lots of other things that we need to kind of get better to get the whole system working better or get these cogs working together to get us going the right direction. Now, like I said, I focus on insulin is right here in the center. What happens is when we eat foods that we were always taught to eat, the fats, the proteins, and the carbohydrates, kind of the old traditional food pyramid. I'm old, so I go back to that. We were taught to eat that way, but when we put it in, carbs break into glucose, proteins break into amino acids, fats into fatty acids. And an average adult has about 5 liters of blood floating in their bloodstream. And when that glucose gets the equivalent of 1 teaspoon, which is not that much, your body goes, I don't want to hear, I want to get over here in the cells. So it produces insulin to help the cells open up to get those fuels into the cells like we saw in the previous slide. But two things are required for those cells to get bigger. We need a high insulin and extra energy. And when we have those two, the cells get bigger. But that's not the only thing the insulin does, is it can affect the liver, it can affect the cholesterol, it can affect us emotionally, it can affect inflammation. So if you have risk factors or things that go along with each of these things, insulin could be a key factor. Like I said, we could talk about hormones. We also can look down here at kidneys. Insulin affects every cell in the body, and we're trying to get the insulin and the cell communication to work a little better. Let's see if we can clean this up a little bit. So as we are trying to help that insulin to cell communication, in my opinion, there's several ways to help with this problem. One, I always focus on the eating habits first. And we'll go a little bit more in depth, but very simply, carbs break into glucose, proteins and amino acids, fats and fatty acids. But part of these amino acids and fatty acids are called essential. And the reason they're called essential is your body can't make it. We've got to put it in. We've got to be mindful about that and try to get all those amino acids and those fatty acids in. When it comes to carbohydrates, there are no essential carbohydrates because our body can take the protein through a big fancy term called gluconeogenesis. No, there's no test on trying to remember that. But that allows protein to be broken down into glucose that now can get into the cell, so now we can convert it into energy. A lot of times to get the weight to kind of start shrinking, we've got to get the cell and the insulin to communicate better. So that's where getting away from what we were taught and maybe switching it to another direction, maybe flipping it upside down, trying to have protein, more healthier fats, and not cut out carbs, but just less carbohydrates. That's one. Two is lifestyle. We'll talk about it a little bit more in depth, but things like sleep, habits, behaviors, exercise. Maybe we need to look at different hormones that might be out of whack that could be making this process worse. Thyroid, sex hormones, cortisol. Then we can go to medications, but a lot of times when we go to medications, most doctors will go, well, let's make you less hungry, when we actually need to help with this communication first. At least that's how I approach it. Again, brief summary of what insulin does. Carbohydrates break into glucose. Glucose, we need it to help the cells open, as we show here. Is that insulin's a key that helps open up the cells so we can get glucose in, so we can now convert it to energy. And when we have high insulin levels, we have a list of several, as it says down here, many more side effects or abnormal effects from having so much excess insulin. So my approach is looking at it from multiple different aspects. I look at food as fuel. And the reason I do look at it fuel is because if we take away some of that emotional aspect of this diet or that diet, I actually hate the word diet, but looking at it as the right type of fuel to get your body or as a vehicle to work better. And I would say prioritize protein. I'm not saying that's all you eat, but start with there. Why, if you remember, it's called essential, or at least part of it's called essential. Second, don't fear the healthier fats. Why? Part of those are essential. We want to put the essential stuff in first. But when it comes to carbohydrates, I'm saying cut back. Now, I don't want you to back off on broccoli and cauliflower or vegetables like that so you can go eat more processed carbs. My simple way would be start with the vegetables above the ground. It's not 100%, but a good way of thinking about it. When I do that, it's going to have a lot less lower glucose in our bloodstream. Before I go to vegetables below the ground, a little bit more starchier. Why? A little bit more sugar. Before I go add fruit, why? A little bit more sugar. Before I eat processed food, a little bit more sugar. Before I go to drinking sugar, a little bit more sugar. So again, we're trying to have less sugar in, so we need less insulin to get into the cell. Then we get into lifestyle. Again, we always talk about the importance of exercise, which I'm a huge fan, and I want you to, especially when you start feeling better. But also could be sleep. That also could be habits. That could be behaviors. That can be environmental factors. It's a lot more than just one simple thing. Then looking at medications. Now that could be stuff that we as doctors put you on to control some problems, but it can cause weight gain. So always asking your doctor if it can cause weight gain. Again, not all of us focus on the same problem, or at least looking at it from the same angle, but that's where medications can be detrimental, but also be beneficial. Then we need to look at different hormones. How are those playing a role? And that's where I'm focusing on trying to get all these systems to work a little bit closer together and work together a little bit more efficiently. But one key factor we always forget, it takes time. I look at this as a healing process. A lot of times will talk to my patients about the idea, if you walked outside and you fell and you broke your leg, breaking the leg doesn't take a lot of time. But healing takes a lot longer time. This is a healing process. This isn't just overnight, everything goes away. We need to give it some time to heal and improve things. So going back to that eating habits, I look at it as, I call it the proper human fuel, to try to take that whole mindset of diet away. Trying to, I would say, prioritize the protein. Prioritize protein. Don't fear the healthier fats. And the handout we're going to give you gives you a list of these foods. But if I'm going to have carbs, I'm going to try to cut back, not cut out, but cut back on the carbs. So it's more of this type of tradition. Now, it doesn't mean you have to be over here all the time. I'm just trying to get you away from over here. Now, this does work for some people. But usually if you've tried this and it doesn't work, guess what? You're probably not talking to me. We're trying to go over this way a little bit more. Now, again, a lot of times we look at just the weight. Oh, it's the number on the scale, and that's all we got to focus on. No, we need to focus on the underlying issues. And that can be, like I said, stress, medications, overeating, undereating, compulsive eating, other hormone resistance like leptin, anxiety, things we're doing for anxiety. So multiple factors are playing a role, and we need to dig into these to kind of figure out what's going on to help this improve. Now, a lot of times I will, if I'm starting medications, I will go to metformin. And a lot of people go, well, metformin is for diabetic. Yes, it is FDA approved for diabetics. And no, you're not a diabetic. At least I hope you're not a diabetic. And if you are, we're going to help you also. But metformin, I would actually argue, is better for pre-diabetics, so your A1C is getting on the higher side, but not a diabetic yet, or even what I call a pre-pre-diabetic, meaning your body's producing a lot of insulin, but the cells aren't responding, so we're producing a lot. So what does metformin do? It helps in multiple different ways. It can help in the brain by making us a little not as hungry. Some people will say nauseous, but it also can help with another hormone called leptin, which tells us we're full, but leptin sensitivity, but also insulin sensitivity. It can help in the muscles by helping with insulin sensitivity, but also increases fat oxidation, or how we're using that. It can help with the fatty tissues to produce less leptin, and with less leptin, maybe your brain gets a signal to say we're full, but it also is helping us not have as much insulin. If we lower your insulin, allows some of this food storage, i.e. energy, to come back out as fuel. It can also help in the liver, but it also can help in the gut with the multiple different aspects. So, welcome to our clinic. There's lots that we can do, lots of information to help you. My goal is to help you get going, but a lot of times we've got to look at going back to that healing process. We've got to heal you from the inside out. Yes, the numbers that we see on the scale is what we're concerned about in a roundabout way and eventually. But my other question is, what's making up the number on the scale? Because that is one of the key factors. Because it's not just about losing weight. If you're losing muscle and gaining fat around the organs, we're not in a healthier place. We want more muscle, less fatty tissue, maintaining the essential organs, and improve things overall. Welcome to our clinic.